My name is Shelby Ardware and I chose the Sacrum and Coccyx. After this presentation, you should be able to identify the anatomy of the Sacrum Coccyx, know how to perform the AP lateral views of the Sacrum Coccyx, and be able to identify if an image is of diagnostic quality or not. The sacrum is formed by the fusion of 5 sacrovertebral segments. It's a curved triangular bone and it's wedged between the iliac bones of the pelvis. The coccyx is composed of 4 rudimentary vertebrae. It usually forms into one bone in adulthood. So for the AP axial sacrum, you're going to place the patient in a supine position. It can be prone if there's an injury inhibiting the person from doing so. So you're going to put the patient's arms on their chest or by their sides away from the body. The central ray is going to be 15 degrees cephalad at 2 inches superior to the pubic symphysis. However, when it's PA axial or prone, you're going to angle 15 degrees cauded and center to the sacral curve. For collimation, it's going to be 10 by 12 and the respiration is suspend. Evaluation for the AP axial sacrum. So the sacrum should be centered and seen in its entirety. It should be free of foreshortening and the pubic bone should not be overlapping the sacrum and no rotation. Looking at the image quality of 2 images for the AP axial sacrum, the one on the left is good, the one on the right is bad. The one on the left, you can see the entire sacrum. There's no foreshortening, there's no rotation or anything like that. Now the one on the right definitely has some tilt. You can see that in the pelvis. It does look a little foreshortened compared to the one on the left. So it is the bad image. For the AP axial coccyx, you're going to place the patient in a supine position. If there is an injury or anything that prohibits the patient from doing supine, you can put them prone. You're going to put the patient's arms on their chest or by their sides away from the body. The central ray is going to be 10 degrees caudal at 2 inches superior to the pubic symphysis. However, when they're prone or a PA axial, you're going to angle 10 degrees cephalad and center to the coccyx. Collimation is going to be 8 by 10 and respiration you're going to suspend. For the AP axial coccyx, the evaluation criteria is the coccyx is going to be centered and seen in its entirety. The coccygeal segments are not superimposed by pubic bones and no rotation. The image on the left is the good image and the image on the right is the bad. The image on the left shows the entire coccyx, all segments of it, no rotation, no foreshortening, nothing superimposing it. And the one on the right, the patient didn't pull their pants down, so you can see their zipper, you can see the button, everything is covered that we're supposed to be looking at. For the lateral sacrum, you're going to put the patient on their left side, you're going to flex their knees and hips, and you're going to put their knees on top of each other. You're going to adjust their arms in a position at a right angle to the body, so just out in front of them. You're going to adjust the pelvis and shoulders to get into true lateral. The central ray is going to be perpendicular at 3.5 inches posterior to the as-is at the level of the as-is. The collimation is going to be 10 by 12 and the respiration is going to be suspend. Evaluation for the lateral sacrum is going to be the entire sacrum, no rotation, and good bony detail and soft tissues. So the image on the left is the good image. You can see the entire sacrum, and if there is any rotation, it's very, very slight. The image on the right, however, has a lot of rotation. The sacrum looks all funky. You can see it all, but it just doesn't look good. For the lateral coccyx, you're going to put the patient on the left side. You're going to flex the knees and hips. You're going to put your knees on top of each other. You're going to put the arms out in front of them at a right angle to the body. You're going to adjust the pelvis and shoulders to get into true lateral. The central ray is going to be perpendicular, directed 3.5 inches posterior to the as-is and 2 inches inferior. Collimation is going to be 6 by 8 and the respiration is suspend. The evaluation criteria for the lateral coccyx. The coccyx should be centered and seen in its entirety. Coccygeal segments not superimposed by pubic bones and no rotation. The image on the left is the good image. You can see the entire coccyx, there's no rotation, and you can see good bone detail. The image on the right, however, you can see at the very bottom that it did clip some of that coccyx. It would have been good if they'd opened up their collimation a little bit, or moved the centering down. For the lateral sacrum and coccyx combined image, you're basically going to do the same thing as the other two laterals. You're going to put the patient on their left side, flex knees and hips. You're going to put the knees on top of each other. You're going to put arms out in front. You're going to adjust the pelvis and shoulders to get into true lateral. The central ray is going to be perpendicular, 3.5 inches posterior to the as-is at the level of the as-is. The collimation is going to be 10 by 12. Respiration is suspend. And to include both, you're going to open your collimation a little bit. Evaluation for the lateral sacrum coccyx combined is proper collimation, entire sacrum and coccyx, no rotation, and bony detail and surrounding soft tissues. So the image on the left is the good image. You can see the entire sacrum, the entire coccyx, nothing's missing, and you can see good bone detail. The image on the right, you can see that the top of the sacrum is clipped. There is rotation, as you can see with the hip joints. You can definitely see that they're not lined up correctly in true lateral. So the first question is, what is the appropriate central ray angulation and entrance point for a PA axial projection of the coccyx? When you look at the answer choices, you have to think about what position the patient is in. So normally, if it's an AP axial projection, it's going to be 10 degrees caudal. So if it's PA, you're just flipping it. So it's going to be 10 degrees cephalad. So that would be letter C. So the second question is, what is the proper central ray placement for a lateral sacrum radiograph? When looking through the answers, you just have to pay attention to what you're looking for. So if we're looking for the sacrum, it definitely would not be B, because B is going to be your coccyx. C just doesn't make sense. And A is just not correct. So it's going to be D, 3.5 inches posterior to the as-is. Question 3 is, what is the appropriate central ray angulation and entrance point for an AP axial projection of the sacrum? This, again, you're just having to make sure that you're paying attention to what position it's telling you it's going to be in. So it's going to be an AP axial. So you know it's going to be 15 degrees cephalad. So you can go ahead and mark out A, C, and D. A would be an AP coccyx. C would be a PA axial sacrum, and D would be a PA axial coccyx.